everyone, and welcome to part 2 of our video series on sound sensitivities in individuals who have autism. I'm Dr. Lindsay Tubaugh, and I'm the co-founder of Little Heroes Pediatric Hearing Clinic in Layton, Utah. And I'm an audiologist who works with pediatric hearing loss, tinnitus in adults and children, as well as sound sensitivities in adults and children. In our previous video, we interviewed Alexa Archibald, who is a behavior analyst that works a lot with children who have autism. And that was a really fascinating interview. But there was a lot of jargon, a lot of terminology that came up that I really wanted to go over with you before we get started on what I do as an audiologist with children who come to me with sound sensitivities who also have autism. So first of all, let's go over a few definitions. So for the first one, what even is an audiologist? An audiologist is a professional, typically with a doctorate level of education, that specializes in the hearing, whether auditory processing or hearing acuity, and balance systems in our bodies. Not all audiologists specialize in the same thing, so be sure you find an audiologist with the expertise of the condition for which you're seeking treatment. For example, I'm an audiologist that specializes, as you know, in both hearing and the sound sensitivities in the brain. But even though I learned about balance systems, if somebody came to me with dizziness or other balance issues, I would refer to an audiologist that specializes in those things. So you want to be sure that you get an audiologist that works with the population that you're looking for. You may have heard Alexa use the term ABA, or Applied Behavior Analysis. So this is a type of therapy program that's delivered through a board-certified behavior analyst, or you even heard her say perhaps BCBA, or can be administered through an assistant behavior analyst, or BCA-BAs. And they work with specific behaviors like social skills, communication, reading, academics, and adaptive learning skills, including fine motor dexterity, hygiene, grooming, and domestic capabilities, and many other things as well. Hyperacusis is a word that you heard a lot in the previous video, and what that refers to as an intolerance to sounds in a person with normal hearing that are otherwise perceived by a person without sensitivity to be non-threatening nor uncomfortably loud. So it's a difference in how sound is perceived by the central auditory processing centers in the brain. Now, presbycusis is often confused with the term hyperacusis, and what that is an intolerance to sound similarly, but in a person with hearing loss. So sounds that are intolerably loud can either manifest as presbycusis if you have a hearing loss, or hyperacusis if you don't. Misophonia is another term that is often used, and it is used to describe both a physical and an emotional reaction, which is typically anger or rage, that's triggered by specific sounds, even when those sounds are quiet. So common misophonia triggers can include chewing, pens clicking, whistling, or other sounds. And a lot of people have experienced this on one occasion or another. A misophonic response is an actual learned reflex. So without therapy, the sound will need to be removed to stop the reflex from happening, which means you cannot talk someone down in the moment while they're having a misophonic response. Phonophobia is the emotional and seemingly irrational fear of sounds. So it's often due to trauma relating to that specific sound, and it may present very similar to misophonia, with the exception that the reaction is fear instead of anger. Diagnosis and treatment for phonophobia is very similar to that of misophonia. Another word that you've probably heard is tinnitus. And tinnitus is the experience of hearing a sound that is not present in the external environment. It's often described as hearing a ringing, buzzing, chirping tone. It's actually also described as a lot of different types of sounds, but it essentially is a sound that a person is hearing but isn't in the external environment. The most common cause of tinnitus is hearing loss. However, there are other reasons that a person can have tinnitus. So the first thing we like to do is rule out hearing loss as the result of tinnitus, and then after that, we want to try to determine more qualities of the tinnitus. Tinnitus can be temporary, it can be intermittent, or it can be ongoing. Habituation is another term that we often use, and what habituation means is that we are reducing the sound sensitivity and its effects that the sound has on the person through therapeutic and appropriately administered pleasant or calming sounds in addition to the unpleasant sound or stimuli. What's really important here that I want to emphasize is you do not want to try to habituate to a sound by continually presenting that sound in an effort to get the child to quote unquote get used to it, because this can make sound sensitivities much worse. Cognitive behavioral therapy for sound sensitivities is an intervention designed to address the way we think, how we feel, and how we behave in relation to sound, and it helps to increase well-being. This can be provided by an audiologist and/or occupational therapist trained in cognitive behavioral therapy that is specific to sound sensitivities. It lasts for about 6 weeks, but that is also dependent on the ability of the person to be able to question their thought patterns. So TRT is something you heard Alexa and I talk about, and that stands for Tinnitus Retraining Therapy. Something similar that you may hear is PTM, which is Progressive Tinnitus Management, and they're very similar, just some minor differences. So both therapies work at helping the child or adult habituate to tinnitus or other sound sensitivities through both sound therapy and counseling. TRT recommends approximately 18 months of therapy to achieve desired and stable results, but sometimes it could take a little bit longer just depending on your child. Progressive tinnitus management adds an additional element, which is cognitive behavioral therapy. So it's a more aggressive approach, and it typically yields results in less time, usually around 6 months, again, depending on your child. Now, don't be caught off guard by the fact that tinnitus is mentioned in both of these, because even though it was created for tinnitus, it also works really well for other sound sensitivities as well. We'll determine whether TRT or PTM is better for your child depending on their specific situation. Listening therapy or oral rehabilitation is an intervention designed to help children and adults optimize how they use what they actually hear. This is something that's provided by a qualified audiologist that's trained specifically in oral rehabilitation. Okay, so now that we've got some of those definitions out of the way, let's talk about some of the tools that we can utilize to administer therapy for your child. The number one thing I love to use for a child with sound sensitivities seems a little bit counterintuitive, but it's actually a hearing aid. And when I tell families that I like to utilize this technology, the first thing they wonder is, why are you using a hearing aid on my child who has normal hearing or even hypersensitive hearing? But really, it's not to amplify any sounds at all. It's to utilize the other features that are built within this type of technology. First of all, we can use what's called the maximum power output to set really high sounds down a little bit lower. So whenever there's a really loud sound in the environment, it isn't quite as loud and obtrusive to your child. Also will help protect their hearing. We can set it quite low, and then over time, as the sensitivity gets better, we can slowly raise it so that we're not actually making the sensitivity worse by restricting those sounds that might normally be in an everyday environment, but it can offer a lot of relief. The biggest advantage of this, though, is using a pink noise program or a white noise, just depending on your child and what they prefer, to constantly stream or intermittently stream sounds into the ear that help to make those obtrusive noises seem a little bit more able to cope too. So the idea of any type of sound therapy program is to offer sounds that are comforting to the child at a relatively louder level, and then over time decrease that sound down in intensity as they adjust to being able to cope with those sounds that are more obtrusive or offensive to them, creating the problem. The other thing that I really like about using hearing aid technology in this population is you can stream anything to the hearing aids from your phone, from your iPad. So if they're watching a movie, if they need to actually turn the microphone off and only stream, that's also a possibility. So if they are a child that has misophonia and there's something going on, we can really quickly get them into a program that's going to be safe and comfortable for them in that moment. Also, there's an app that families and parents, teachers can utilize to help control the different programs of the hearing aids so that the child is getting what they need right in that moment. And that can offer a lot of resources to parents to be able to utilize to contribute to the therapeutic program that the child is in. Hearing aids have built within them noise reduction programs. So when going to the mall or to the cafeteria or somewhere noisy, those noise algorithms are going to kick in and help provide a little bit of relief for your child wearing a hearing aid. One really awesome thing about hearing aids now is that a lot of times they can be adjusted remotely. So if you are in a sound therapy program with an audiologist and you have difficulty coming into the clinic, or your child feels unsafe in the clinic, once they've been fit in the clinic and diagnosed, then sound adjustments and therapies can often be done through virtual platforms, which can make it a lot easier for families and especially for the child. Another huge advantage of hearing aids is that when you work with pediatrics, they typically come with a 5-year warranty for damage. So if they get damaged, you don't have to worry about a lot of costs associated with that other than that initial lump cost of the hearing aid itself. They also come with a one-time replacement warranty in case the hearing aid itself gets lost or damaged beyond repair. So that can be really comforting to families. And if you're worried about your child being able to keep the hearing aid on their ear, there are a lot of ways, a lot of little clips you can buy on Etsy or provided by the audiologist to make sure that if they fall out of the ear, they're still connected to the child's body in some way. In our clinic, we always offer a trial period or rental period where the child can actually wear them, because that's one thing we don't know. Is your child going to be able to tolerate having something in their ears? So I would recommend that if you go this route, you make sure that you are covered by a trial period or a rental program type thing, so that you can actually have your child rent or wear the hearing aids and you can see how well it's benefiting them before you take the leap and make that big purchase for your child. And one final benefit I'll tell you about regarding using hearing aids for your child is what's called a miniature microphone, or they're called different things depending on the brand of hearing aid that you're utilizing. We give these to all of our patients who we dispense hearing aids to, but it's a little microphone that the teacher or the parent can wear that will stream directly to the hearing aid itself. So if you're going somewhere with your child and you want them to hear you more than all of the other sounds that are around, you can talk and that microphone will send your voice directly to your child. This has been a huge advantage for children in the classroom when the teacher is wearing this. I've had parents say in Costco when they've gone with their child, it's been just a tremendous help. So one final plug for getting hearing aids as part of your treatment program is that you can get a device like that will stream information directly to your child to help with all the other noise around them, because your voice will come first. So hearing aids range a lot in price depending on the different features that people want. For this type of population, you really don't need the most fancy, expensive hearing aids there are out there, but you do want something that has these features that I've been talking about. At our clinic, those sell for about $1,000 for 2 hearing aids, and that's quite a bit of money for a lot of families to pay. If you can afford it, it's definitely the way to go, but if you can't afford it, don't worry, there are still other things that you can do for us to be able to offer this type of sound therapy for your child. So let's talk about headphones for a minute that have streaming capabilities. I actually really like these, and I have these myself. What I have is the AirPod Max headphones. I really like them because I can stream anything that I want to, and I can either push a button and hear what's going around me while streaming, or I can push that button and I can block out what's going around me while I'm streaming. And this could lend very well into this type of population who needs that immediate control of having something blocked out. So we could be streaming some pink noise or other sound as part of their sound therapy program, and then if something happens that really triggers them, they can push a button and it can block out those sounds while still giving them that auditory stimulation that they need. So that is one option. AirPods and Bose has come out with something similar, and I'm sure that as time goes on, we'll see more and more with this what's called transparency mode. They usually run between $500 and $600, so a little bit less than hearing aids, but you won't get the same types of features. You have a little less control over the sound, how the sounds are being processed and presented into your child's ear. They're bigger, which may be an advantage and maybe a disadvantage. And so these are some of the things that you want to think about when you go into purchasing something like this. But sound therapy protocols can be delivered through these types of headphones just as well, as long as they have that streaming capability. Just know that as a parent or a teacher, you have a little bit less control over what that kid is actually hearing. So you may think they're hearing everything that's around them, but they've switched it into that, sound blocking mode while streaming something else, or vice versa. So a little less ability to control what's going on, but it's still a fantastic idea if hearing aids are a little bit out of reach financially. The other thing I really like to offer parents to get for sound therapy, if both of those things are out of reach, are bone conduction headphones. This is also good for a child who won't tolerate something in their ear, because bone conduction headphones work by sending vibrations through the bone into the inner ear. So we can still stream and deliver that sound that we need for sound therapy, but we're not blocking the ear at all. Still something they have to wear, so we have to try to make sure that they can cope with having something on their head, but that is still a really good option for sound therapy. Now keep in mind, because this isn't something that's going over inside your child's ear, it doesn't offer any type of sound protection. So if there's another noise going on, you could turn up the volume perhaps of what's being streamed, but it wouldn't offer any type of sound protection or hearing protection to your child. The warranty on this type of a device, again, is usually very limited. And with this type of a device, you're looking at around, I've seen them for about $75. So relatively inexpensive comparative to these other things. So if you really can't afford the other options, this is definitely something that you should consider for your child. So finally, let's talk about headphones that simply block out sounds completely. Or I've seen a lot of devices coming out on the market, and I'm going to review a few of them in upcoming videos. But little plugs that you put in the ear to tone down sounds or to block them out completely, or as much as those devices are able to. And the concern that I have surrounding these devices is that if you wear something that is blocking certain sounds out, because those are the sounds that are causing the sensitivity, it can, if utilized too often, it can make the sound sensitivity worse. So while I am supportive of using these type of devices in certain situations or for an emergency or one-off situations where you know your child's going to be triggered, but you don't want to limit your child in what he or she can go do, then I am supportive of using those in very limited time spans. So please be careful that you're not simply blocking out sounds for your child in an effort to help them cope, because in the long run, it's going to make their sound sensitivities worse. I know that can be really difficult to hear. And again, I encourage you to use them here and there as needed. If you're going to a fireworks show, if you're going to Disneyland and you really are concerned about how your child's going to react, utilizing them here and there is perfectly fine and good for everybody's mental health and mental well-being. Just be sure that it's not something that you're constantly turning to, because the last thing we want for these kids is for their sound sensitivities to get worse. So that's all I have for today, and I could go on and on about the specifics of the therapy programs, but really that's what your audiologist is for. So if you have specific questions, please feel free to reach out to me personally. I will put my email down in the section below describing the video. I would love to talk to you if you have any questions or concerns about your child or the care he or she is receiving. really any questions at all. This is what I love. This is what I do for a living. I live it, I breathe it, and we really just want your kids to be as happy and healthy as possible, as well as you as their caregiver. So thanks for joining me today, and I will see you again soon.